Hi, Diana. Welcome to the Integrative Health Coach Success Podcast.
Hi, Julie. It's great to be here.
Yes, great to have you. I always get excited when I get to interview one of our own EquiLife health coaches because we kind of, even though we get to meet with each other, multiple times a week, I always end up learning more individually about each of you. So I find it extremely fun. So thanks for being here.
Of course.
What I would love to do to start is, could you share with our listeners a little bit about what you're currently doing on the EquiLife team as a health coach?
Sure. So I started in January with EquiLife, and I am a health coach that is able to see all of the testings that we do for all of the clients and go through all of the protocols and help people with their wellness plans. And I do that all day, Monday through Friday, and it's fantastic.
Yes, hard to believe that it's just been January since you've been here. I feel like it's been a lot longer than that. And yeah, you're very experienced. So, okay, so let's kind of back it up. If you would share with our listeners a little bit about kind of how you got to the point where you were working with EquiLife, because I know you did a little bit of, health coaching on your own, and what were you doing for, your career before you found health coaching, if that's something you haven't always been doing, if you want to give us just a little background.
Definitely. So I started doing laboratory work in 2004, where I was testing cancer biopsies to look for gastrointestinal issues, and kind of worked my way through that for a good, 15 to 17 years. And it started taking a toll when you see so much cancer coming through the lab, and you start to wonder, how can I be on the more preventative end instead of where we're giving the news to all these clients that I'm so sorry you have cancer, now this is how you have to change your life. I wanted to start to learn how to be on the forefront of that, where I could say, you're trending in a downward, way. We would like to get you back up and increase your health. What are the ways that we can do that by finding the root causes and things that can help you feel better before things get this drastic? So I found out about health coaching in about 2018 and started getting some certifications going down that path, and then came across Dr. Cabral and his IHP program, did that with the IHP level 1 and 2, and then started health coaching on my own with my own career path, and trying to, of course, we all start with ourselves and kind of find what is bothering us and, fix that. And then it kind of turns into family and friends, and then the word kind of gets out, and then you kind of get more family and friends, and then other people that you don't know eventually down the line.
Yes. And so how long were you doing the health coaching on your own?
From about mid 2019, about 2020, till when I came upon EquiLife looking for health coaches at the beginning of 2022, and applied for the job, and now I'm with EquiLife.
That's great. So what I would love to chat about, since we kind of, there's most of the people that I talk to, most of the health coaches that are kind of running their own business, they've kind of gone from doing their health coaching, or getting their certification and then getting into health coaching right away and kind of working for themselves. Mm-hmm. You kind of have this unique perspective on health coaching on your own, but then moving into a company setting where you're working with like a team of health coaches. Mm-hmm. So let's do kind of like a little behind the scenes as far as, or, in a back and forth conversation between you and I about what some of the differences are or the benefits. And then we'll talk about maybe, a con or two of working within a team setting versus kind of just working on your own. So I'm curious if you have any big differences. So what are the biggest benefits that you would say you've noticed between working for yourself versus working in a team setting like EquiLife, where I think we have at this point maybe 12 coaches? Are there that many of us?
12 or 13 of us. Mm-hmm.
Yeah. Okay. What's one of the biggest benefits that you've kind of noticed from that shift of working on your own to within a team of coaches?
Well, I think one of the big benefits of working with a team is really the the access that you have to everybody else's insight and specialties into maybe information that I didn't know from the past and that they're more specialized in. So if I have questions, and we meet a couple of times a week as our group team kind of health coaching meeting, and then we're able to take these more specialty cases or just something that I've never seen before, and I can bring it to the group and say, I've gone through this, I've tried to do some research on it, and I just want to make sure that I'm giving this client the knowledge, to my best ability. But does anybody have any other insight into a thyroid issue or a hormonal issue or, really anything? And then everybody really is great and they give their feedback, and we're just kind of able to go back and forth and not only building my knowledge, but then I can also go to that client a little bit more well prepared and say, this is the information our team looked at this, and this is the information we came up with, and hopefully this will be able to help you with your wellness plan. So I feel like that's one of the top things that I've really benefited from with kind of coming into a more company group setting. Now, on my own, I would spend way more time researching just because I definitely had less clients at that time. And you could do that, kind of take 2 or 3 hours and kind of go down a rabbit hole and kind of dig in deep into something. But you never know if you're finding all of the information, where some of these coaches, like yourself, you've been here for years and you have that insight into, oh, I've already seen a case like that, or we've already done the research on this. So you can get more easily accessible information. I would feel like that's definitely one of the bigger perks.
Yeah, absolutely. Yeah, I couldn't agree more. And I think it's nice to know, like you said, you can sit in front of the computer and research it, right? And kind of what you're getting for research type of data, but to talk to a coach who's helped a client work through a specific issue, even if you get to the same amount of knowledge, right? Both avenues lead you to the same amount of knowledge. Talking to another coach who's like, oh yeah, I've totally seen this, and this is what we did. This is what's worked. This is what didn't work. Exactly. It kind of gives you a little bit more of that like real life coaching type of support and knowledge through the avenue of like somebody else sharing. And it's probability, right? If you have 13 coaches sitting in a meeting, there's a better chance that somebody's seen what you're coming across and can kind of help you, versus maybe if it's just 1 or 2 coaches, or if it's just you by yourself. It kind of allows for a lot of coaches who've been doing this for a significant amount of time to share their feedback with kind of what they've seen, come through the door.
Exactly. And a lot of the coaches have, other health career specialties that they did before that they got to the EquiLife point. So we've got, a couple of PAs on the team. So they've been deep into the medical setting where they've got more medical based knowledge from working in the hospitals, to some people that have more ear, nose, and throat specialties. And so it's really, really nice to be able to have that as a team setting and be like, you can even message them directly and say, hey, I've got this one particular case, and I feel like it's something that you may have experienced in your previous career. Would you give me a little insight into that? Especially one of our other coaches that has worked a lot with tube feedings and things like that. We're always seeing those kind of specialty cases come through, and we definitely have to make sure we're careful with those. And that specific coach always has a lot of great insight into how you can help them kind of move forward on their health path.
Yes. Yeah. I was actually thinking of Dana when you said that. Yeah. She's worked in hospital settings, and I never would have thought, I think for a wellness practice, we see probably more than I ever would have thought clients on tube feeds. And it's one of those things where to have somebody who's literally been an expert on it in a past career and knows so much about it, kind of be in our meeting and be able to give us, feedback that we're able to share with the client. We still direct them to their medical doctor, and they're still completely involved in with their medical team as all of that's concerned. But we're able to kind of come to the table with some sort of knowledge about 1, what they're dealing with, 2, how we can kind of help support them, because we have someone on the team that's able to kind of offer us that insight without us having to like sit for hours and, dig into Google.
Exactly. Yeah. And knowing that, she's got even information on like gastroparesis, people that have, the weight loss procedures where they've had tummy tucks and, part of their intestines removed and things like that. All of that insight is so helpful to really giving us the knowledge and then being able to share that with the clients. And then sometimes even the things I share that we've learned in our groups, when they've worked with medical doctors for years, they're like, I've never learned that. No one has ever told me that. It's been 10 years that I've been going through this process, and I can't believe I'm only hearing it now. So, and that's just really enlightening, not only to us, but kind of knowing that we're really helping them kind of move forward in their journey.
Yes. Yeah. And offering a support that no one has. Yeah. And we have Erica, who's a PA, and she has emergency room experience. And so like the stuff that we might see come across in an intake that's like, oh my gosh, versus what is this? She has tons of experience on. And like you said, when we're able to kind of offer just like a little bit of even compassion and slight knowledge, the client then feels better supported, seen. They're able to move through a protocol, better because they know they have like a certain amount of support on our end.
Exactly. Yeah.
Yeah.
That's definitely helpful. And I'd say another perk is really having the additional kind of email support where any of those questions that kind of come back through following up with the client, where on your own, you would have to take a few hours out of the day to sit there and go through emails and answer questions. A lot of those times we give our specific feedback through like a chat portal or something, but a couple of the other team members that we've got are very specific to handling a lot of the follow-up questions. And that not only saves us time so that we can continue moving through cases and learning more information to help the other clients that we're about to see, but they have already seen a lot of those questions that have come through. So again, the client's really getting the feedback they need and the support they need with information that they really need to continue with that wellness plan that we've provided.
Yes. Yeah. I love that you bring that up, because I think one benefit of like being part of a team is the efficiency, right? Like we're able to be efficient with what we're good at. We have some team members who are incredibly gifted with their writing and the detail of giving feedback because they've been doing it for so long. And those are the ones that kind of handle the chat portal stuff with our feedback when needed. But if our expertise and our kind of, gift that we bring to clients is specifically working, on their wellness plan and, talking to them, we're using our time to be in meetings with the client and developing their wellness plan. And we're all being efficient with the things that we're best at, which kind of then makes like the whole ship work better.
Exactly. I definitely agree.
Yeah. And I would say, to add one more, I think a lot of doing health coaching, I think any coach, even if it's not health coaching, I think just coaching in general, regardless of what you're kind of helping someone achieve or helping someone move through, it can be energetically draining at times. We're all incredibly grateful for what we get to do and what we are able to provide our clients and the world. But sometimes there can be, frustrating cases. There can be frustrating clients. There can be moments where we need support. And I think a lot of, so we get knowledge, but we also get good emotional kind of community-based support with our internal coaches on days that feel hard, or we're overwhelmed, or things kind of feel like they're, not so sunny. And we're able to kind of pick each other up on any given moment and kind of say, that's normal. I've been there. This is how I worked through, a client who had a boundary issue. And this is what we did, and it worked incredibly well. Or this is what I did, and it didn't work well. Don't try that.
Right.
Those types of things where we're able to really offer the emotional support that I think a lot of coaches need. If you're working with a high capacity, it can be a lot of energetic drain. It can also feel energetically super uplifting, but not every day is perfectly like that. And so I think sometimes when we kind of have someone to go to who knows what it's like to have a day like that, it can be a really good support. Would you agree?
I definitely agree. And just like your interview last week that you had with Dr. Jennifer, she's also, part of our EquiLife team. And we have a meeting with her once a week in our kind of broken out groups. And she's very supportive and, making sure we have a safe space to kind of express our emotions, any frustrations, kind of get it all out there on the table and try to find out, why maybe this case bothered us so much and, why we feel the way we feel about specific things. And we're able to kind of look into that a little bit deeper. And then we can have those one-off conversations with her, even to kind of, vent things out and feel feel, more confident about the work that we're providing our clients so that we are all on a good path. And we all have to have that mental space that we're in and, feel good about ourselves to be able to provide that help for everybody else. And just like you said, it's great to be able to meet with the teams and really talk about everything in an open space and know that you're going to get that supportive feedback every single week.
Yes. Yeah, absolutely. Yeah. Having Dr. Jennifer, she's kind of like the, the mother of the coaching staff in the sense that, we're able to, like you said, bring whatever we kind of have to her in a way that's completely safe. And we can talk about, okay, like, how do we troubleshoot this?
Right.
And if you're working on your own, I often, know a lot of coaches who they actually hire somebody to have kind of be their mentor and their support, because it's really important that when you're doing work that's serving others, you're also making sure that you're taking care of your own energetic well-being and you're troubleshooting things that are kind of coming up for you so that you can better show up for your clients.
Exactly.
And we're lucky enough to kind of have that built-in support every week where, new coaches can bounce stuff off of her that they come up when we're new, but also, I've been coaching for 12 years and there's still stuff that I, find extremely valuable to take to her and get her feedback on to kind of just, again, get some sort of support. Like you're never like to the point where you don't need some sort of, ongoing help and motivation. So yeah, I would say that's a huge perk.
Yeah, definitely. I agree.
Yeah. If you were to kind of come up with like one, and I wouldn't say con necessarily of like working within a group setting, but what might be one thing that you miss about working on your own? Is there anything that, since being part of a group, we've talked about all the benefits. Is there something that you kind of miss about being on your own?
There's not very many, it's great really working with the company, kind of going from that day-to-day lab work. And then in that transition period for a short period of time, I worked with a different chiropractic settings, being their more naturopathic, type of help functional medicine inside the buildings. And even with that, I was able to kind of schedule my day as I wanted and kind of see clients when I wanted to. And if you said maybe I was having kind of a mentally rough day, I could just tell them, I'm so sorry, I'm not able to show up today, to my fullest. Can we reschedule? Now with a company, that's the only thing that you can't do. You kind of got your schedule set for a week out, if not 2 weeks out. And those days are set in stone. And, unless something drastic happens, it's not as easy to say, I just am having a hard time showing up today. So you just really have to get your mindset right in the morning and take that time for yourself and make sure that you're there and able to show up for your clients. And if you need a little more time, it might take, instead of 1 cup of coffee, I might have 2 or 3. But other than that, everything else is great.
Yes. Yeah. And the truth is when we need to, like you said, in an emergency or like if we're sick, we absolutely can take time off. But I also, think that in the same respect with, having clients that you're able to kind of have that more flexibility with. The flip side is it's also nice to not necessarily have to worry about like where the next client's coming from too, right? Like for a lot of coaches who are just starting out, they're trying to build their business. They're trying to, build some sort of a financially sustainable practice. And while you're getting going, it's kind of like, oh, okay, I only have 1 client this week, or I only have 2 clients this week. Right. Whereas we're, kind of seeing a thriving company and our schedules are booked, and which is actually like an incredibly beneficial and great thing that we're grateful for. Yeah. Yeah. But like you said, with that comes responsibility to kind of show up for all of those clients that are waiting. And as you stay with the company longer, I think now at this point, probably like 90%, 95% of my schedule is all clients that I've seen before. And so they're, they don't want to be moved to another coach if I'm sick, or they don't want to. So shuffling those, those clients when something comes up it can be challenging. And we have a great admin team who helps us with that, which is another, huge perk, but it also, can be a lot of work to kind of change things last minute. So yeah, definitely pros and cons to both sides of that for sure.
Yeah. sometimes when, you have a no-show client, when you go to start your phone call on Zoom and they're just not there, and you try to reach out to them and contact them and you can't get a hold of them. So then they end up having to reschedule their appointment. Well, that happened to me a couple of weeks ago. And this lady, when she finally got in almost 2.5 weeks later, she was like, I can't believe that didn't work out. I'm so sorry. And then I had to wait so long. And I'm like, well, we do have a lot of clients, which, like you said, it is amazing to be able to know that you have the clientele that really wants this help. And when you're on your own, that's exactly what it's like in the very beginning. You're just kind of looking for anybody that is kind of going down this help avenue. And a lot of people still stick to that conventional medicine, which is perfectly fine. But, always having that a health coach in your back pocket is always a good thing. So trying to find those people that are looking for that, different type or an alternative style look for their health path is always something that's a little harder to find on your own.
Yeah, absolutely. Now, so I'm going to ask you another question, just because based on what you just said, that I'm curious about. So you kind of chuckled at the beginning when you said, working with friends and family, and then you were like, oh, and then more friends and family. And did you find it challenging to work with friends and family? Do you think it was easier to work with friends and family versus like perfect strangers, that we meet through, EquiLife?
Mm-hmm.
What were the challenges of working with friends and family that you kind of came up against at the beginning?
I think it was good and it was easy and they listened, which I know a lot of families don't do that. Yeah.
That's good.
It was great. I think my mom was the first one to kind of jump on board. She wanted to see some weight loss. So we worked on that. She lost 50 pounds. And then when we did that, then it really kind of transitioned into, okay, cousins, aunts, uncles, everybody else that kind of wanted to jump on board. And then their friends and family saw with, their relatives and then our other cousins. And then and we're all in different states. There's not a lot of us in this, Texas is where I'm at. So just kind of went outward from there, which was great and fantastic. And everybody was able to see results. But then there are those things that they do not know the boundaries of when, okay, now they're calling you all the time and they have all these questions. They want to go out to dinner. They want you to look at the menu. They want you to go through the menu and send them all the options they should eat. And you're like, that is not what I'm here for. And you're trying to learn and to teach them. And so it was a little bit of that. But, you still have a couple of clients that are like that in the very beginning as well, where you're trying not to handhold everybody and you're trying to teach them so that they can kind of move forward on their own. And it just does kind of have to be like that in the beginning. But I feel like it was just a lot of a boundary issue. So it was nice that they listened, but then they were just there a lot.
Okay. Yeah. So that's so interesting, because if somebody were to ask me the same question I just asked you, I would be like, oh, it's more of like, are they going to listen? And I think specifically with my parents, my mom, if you're listening, sorry, mom, but she is like, tell me what to do. She'll present all of the things that she like wants to fix. She's like, oh, my stomach is this and that. And I'll tell her what to do. And she does nothing. And then like my dad, he, shows up to Thanksgiving dinner with his supplement box and he's like, oh, I'm out of this. And, so I guess you never know what you're going to get. Like one's a very good student. One,
exactly.
I call her a wannabe student. She tries, but, and then, so, and then sometimes it's, kind of friends-ish of family who, them. I actually find that that's the hardest, or that those were the hardest, clients to work with, because they're not quite like close to you, like a cousin or a mom or an aunt would be, to where you can just like have a candid conversation, but they probably feel comfortable enough to push their boundaries. And then you kind of have to make sure that you're setting some sort of boundary with them so that they're, you're giving them what they need, but you're not also, like you said, holding their hand through, every little restaurant visit and whatnot. So I find that like middle person is the hardest, because my mom, I can say to her, Mom, you told me that your stomach bothers you after you eat. How come you're not taking your digestive enzymes?
Right.
Where, you can talk very candidly to a family member like that. But when it's like a friend or like an acquaintance, there's like that middle ground of, you can't quite be, that candid, but also you're needing to kind of like hold that client boundary.
Yeah. Because, and then friends have known you for so long and they know how you were. And of course, we didn't always know these great habits to have and these eating regimens that we're on now and how we made our body feel the best way. And so then they're like, well, you always ate pizza before. You always had ice cream before, and you didn't ever say anything about it then. And I'm like, I understand, but now we know these things that have made, ourselves feel better. And now we're just trying to like spread the word. And you're coming to me with these digestive issues, and then they don't want to listen, but they do want to listen. So it's kind of this in between, like you said, where it's just kind of a battle of how far are they going to move forward with you if you're able to help them, and how much information are they actually going to listen to and absorb and kind of move forward with. So it is a little bit of a battle.
Yes. Yeah, for sure. And I think it's, too, like to your point about like, oh, well, you used to eat ice cream and you used to eat pizza, and and maybe even sometimes we still do. We're human, but our job is to kind of present the bulk of education that's health minded so that you can take that into your living 80% of the time and significantly improve your health. Like none of us are claiming to be perfect. I also have acquaintances and family members who like, we show up to a birthday party and just because I'm a health coach, they're like, oh, this is gluten-free if the kids want this. And I'm like, it's okay. My kids, that there's really not anything that my kids don't eat. I don't purchase a ton of gluten products or, dairy products for my house because I believe that if they're eating healthful in our house a majority of the time, then whenever we're at a birthday party or something like that, that's not going to tip the scales. But people can automatically assume that I'm like this health drill sergeant.
Right.
And it's kind of like, it's not necessarily how I am. And so there can also be like assumptions too, right, about how we're kind of going through our life as coaches.
Definitely. There always are, every time.
Yes. Yeah. Okay. So one other question that I typically will ask people that I'm interviewing is, I obviously see the rain barrel effect behind you. And so that's one book I'm sure that you've read. If coaches are listening and, they're kind of like up for a new read, or is there any books, podcasts, any like piece of literature other than like what would be, typical IHP or, related to Dr. Cabral that you kind of have, that you love, that you've read, that kind of causes, some sort of it helps you to think about things differently or build your knowledge in the past?
I do like a couple of podcasts. I made sure to bring it up, so I said the right thing. It is Health Heroes by Tim James. I really like that podcast. I'm not sure if you've ever heard about it. He likes to be very chemical free, all natural. So he has a lot of good guests on that go into really in-depth conversations about their specific topic and all natural methods of, making your body feel better with whatever situation they've had to deal with in the past. Him, and I've just recently started listening to, I haven't listened to very many of them, but it is this gentleman called Jay Shetty. The podcast is On Purpose, and it's more of a mindset, kind of like Dr. Cabral's Mindset Mondays, where just kind of getting you in a good mental state, kind of going through all of these things that are happening in the world right now and how we kind of need to reset and think about them with a good open mind, and just kind of how you bring yourself to the table. So those are the two I'm listening to right now.
Okay. Yeah, great. They sound like they're two great ones. I haven't heard of either of them, so thanks for sharing.
Sure.
Okay, so if anybody is listening and they kind of wanted to learn a little bit more about you, do you have a social media page? And if not, totally fine. Or anywhere else that you kind of share your general health knowledge?
I am on Facebook, but that's really all I partake in right now. I'm still a little overwhelmed, so I don't really do too much else, but I am going to start doing some of the live Facebook chats. So that'll be something soon that I start in July and August, that you can find me on our live chat through EquiLife.
Oh, perfect. Yeah. I think you'll really enjoy those. At first they were super intimidating for me. But the community is so great, and you'll love interacting with them. And I think you'll be great at it. Yeah.
I'm sure it'll be fun. I like getting answers and questions and things that I don't quite know. So I may have to dig a little deeper, take a little time to kind of get the answer, but it's always fun getting these random questions and you really just kind of have to make your mind work. It's something that you may not get asked every single day. So it's always fun to help people with their questions.
Yes. Yeah. And part of the beauty of our job, because we're in an industry where we're always learning, there's like always something new to know. And it keeps things interesting. So yeah. All right, good. Look out for Diana on the Facebook Lives. Thank you so much for being a guest on the Integrative Health Coach podcast. It's been such a great time talking with you. Thanks for sharing all your wisdom, past and present. And I appreciate you for being here.
Well, no problem. My pleasure. I had a great time, Julia. This was fantastic.
Okay, we'll talk to you soon, Diana. Thanks.
Thanks. Bye-bye.